Well, good morning. It's good to be back. It hasn't been that long ago that I addressed that beautiful room here, and I'm very happy to have that opportunity again. So welcome to today's discussion. Dear colleagues, ladies and gentlemen, and of course to everybody who has been organizing that important event. A little more than a month ago, the World Health Organization declared the end of the global COVID-19 emergency. As we know, the COVID-19 pandemic led to dramatic loss of human life. It has equally presented unprecedented challenges to public health around the globe. It sent shockwaves through the world economy and triggered the largest economic crisis in more than a century. And I can assure you from our work with our partner countries, that crisis is far from over. Studies also show that countries that learned lessons from previous health emergencies, for example, from the Ebola epidemics in West Africa in 2014, were in a better position to cope with the crisis than others. The same is true for countries which had a strong social protection system in place, such as Thailand, for example. This, ladies and gentlemen, emphasizes the significant benefit of investing in resilience of health systems, health insurance schemes, above all in resource-poor or fragile settings. Last year, the Pandemic Fund was created. We just talked about it a little bit. This fund intends to finance critical investment to strengthen PPR. Don't need to translate that here, I guess, pandemic prevention, preparedness and response capacities, with a focus on low and middle income countries. And I am proud to confirm that Germany is currently the third largest contributor after the European Union and our friends in the United States of America. More encouraging news evolved in April of this year. The WHO officially opened an mRNA technology hub in South Africa. This, we believe, is a vital step towards the production of high-quality vaccines and the pharmaceuticals on the African continent. Building up local vaccine production capacity is a substantial and sustainable risk mitigation strategy considering future pandemics. It strengthens health systems in the interpandemic times and boosts the national economy in a long-term perspective. Therefore, I am very glad to share with you that Germany is currently supporting local vaccine and pharmaceutical production in Africa with more than 550 million euros. However, despite this progress, we are also facing a myriad of crucial challenges at the beginning of this post-pandemic phase. The COVID-19 pandemic slowed down and, in some cases, reversed progress towards achieving the health-related SDGs, especially SDG 3. And I'm afraid that I have to add that not only on the health sector it slowed down progress on SDGs, and we are currently preparing for what will be a kind of half-time summit in New York. So I think the overall balance of achieving the SDGs will be rather disappointing, to put it mildly. And while we need a lot of energy and resources to counter these challenges, there's also a real risk that the international community falls back into the well-known cycle of panic and neglect. And we are already seeing that, and I may add that there's a danger that it's not only happening in neighboring countries or in countries in the global south, it's also a real danger that this is happening here in Germany. So we also have to acknowledge as a federal government, including my ministry, that we are facing growing budgetary restraints. Parliament is in session, that's why I unfortunately cannot join you over the day, but that is one of the major topics right now. And we have to deal with that. Other countries and stakeholders, unfortunately, are in a similar position. At the same time, the situation in global health calls for action. In low and middle income countries, government expenditures for health still account for only 12% of the total health financing on average. That is less, oftentimes, much less than funding from international donors. And sadly, out-of-pocket payments, that is, fees which users have to pay at the point of service, still make up to 70% of health expenditures in low and middle income countries. Ladies and gentlemen, dear friends, the evidence is clear that the substantial reliance on out-of-pocket payments is one of the major barriers in low and middle income countries for achieving SDG 3. They exacerbate existing social inequalities, and it poses very hard trade-off decisions on families to either providing food for the household or paying for the required treatment for a sick child or a family member. And it's also a major cause of poverty. Every year, more than 100 million people fall into poverty because of catastrophic health expenditures and the lack of adequate social health protection. And in addition, we see many challenges at the multilateral level involving financial needs for PPR. So the new pandemic fund, which I have mentioned just a few minutes ago, needs a lot of more long-term donor commitments to assure its important medium-term oriented aim for ensuring worldwide pandemic preparedness. And we are still far away from achieving that. 3 weeks ago, the World Health Assembly in Geneva decided about the creation of a medical countermeasures platform was proposed there. And while the concept is promising, there are still a lot of difficult questions. Besides challenges around coordination and governing such a global mechanism, there is a lot of financing, and we are talking billions of euros of so-called surge financing that needs to be mobilized to put this into practice. So, what can we do? How do we cope with these challenges? How do we finance health for all in times of scarcity? First, I believe it's essential that we keep global health on the top of our agendas. That's a responsibility for us as politicians, but you cannot leave it alone to the politicians. So I think a meeting like this will help. You all know that in spite of what I mentioned with regard to budgetary restrictions, Germany is one of the largest donors for global health, with over 1 billion euros of contributions in the past year. And we are willing to continue our leadership role, although fairness requires to say that I cannot predict the future also when it comes to our budgetary discussions. But BMZ, my ministry, is about to launch our new core area strategy for health, social protection, and population policy. And we will stick to that in spite of the economic pressures. With this new core area, we intend to intensify our collaboration with partners all over the world, as well as with multilateral partners in health. And secondly, I cannot emphasize this enough. It is important that we stop considering the health financing only as a cost. Instead, we need to understand that health financing indeed is an investment. It is an investment in our long-term health and our social and economic well-being. I'm sounding like I'm trying to convince our budget committee, but well, it is an investment in our long-term health and our social and economic well-being. There's a lot of evidence that shows that investing in health results in economic returns at several levels. To give you just a few examples, investing in childhood immunization does not only save lives. For every euro that a low and medium income country invests in immunization, they receive 44 euros in economic gain on average. Moreover, the WHO estimates that the annual economic gain of investing in strong primary healthcare systems in sub-Saharan Africa is 10 times greater than that investment. And a recent estimate by the Imperial College in London found that the global level financing for pandemic preparedness could have gains that are up to 1,000 times higher than the necessary investments to respond to a pandemic comparable to what we just went through, the COVID-19 pandemic. So, the investment case for universal health access to qualitative health care is evident. Nevertheless, we still face a significant challenge of limited financing due to many other competing priorities. So again, how do we cope with this? What is the role of a donor country like Germany in this? Unfortunately, there is not one clear path, but I would like to share some possible approaches with you. First, we need to make better use of the money we have. We need to use the funding that is available in an even more efficient manner. We also need to make a more targeted and strategic investment decisions. One way to do this is to focus on priorities. Primary healthcare should be placed at the center. The same applies to sexual and reproductive health and rights. In these areas, the return on our investment, ladies and gentlemen, is especially high. In addition, we should focus on measures that contribute to both achieving SDG 3 and increasing health security. Evidence suggests that around 30% of health system financing also serves directly increase the level of pandemic preparedness and prevention. Second, it is evident that further progress towards achieving SDG 3 will only be possible if governments in low and middle income countries increase their domestic financing for health and reduce catastrophic out-of-pocket payments and their devastating consequences, which I mentioned. And we, ladies and gentlemen, we can support partner governments that are willing to make a more sustainable investment in health and mobilizing more domestic resources. One way of doing this is through reforms of taxation systems. Another approach is to introduce new earmarked taxes in form of a health tax on products like tobacco, alcohol, and sugary drinks. We should also take into account public financial management systems and the transparency of the flow and use of public funds. Here, for instance, digital tools as well as social accountability play an important role. And thirdly, strong, functioning social health protection mechanisms have to be set up in countries which also cover poor, vulnerable, and informally employed people and to ensure comprehensive access to services. Minister Svenja Schulze has therefore made social protection one of her top priorities. And while I'm speaking, my colleague Bärbel Kofler, State Secretary Bärbel Kofler, is opening an important conference on that very issue. So my fourth point is we should also talk about the private sector, not as an excuse for the current budgetary decisions, but because we know that without the private sector, we will not be able to finance what needs to be financed. So that should be incentivized to invest more in medical products and infrastructure and markets. In this sense, we welcome the impact investing initiative of the Japanese G7 III initiative. And Germany, as you may know, has a strong portfolio itself. Through our development bank, KfW, we invest in 3 social impact bonds in global health. The focus is on small and medium-sized enterprises with the goal to increase access to medical products for populations in need, especially in low and middle income countries, and especially targeting women and children. And finally, another possible way for increasing domestic funding for health is through targeted debt swaps. For example, the German government uses the innovative debt to health financing mechanism of the Global Fund to convert bilateral debt into targeted investment into public health. So these are just some of the approaches that we are implementing and that we have in mind so far. But as always, we need to do more. We need to think outside the box and find additional innovative ways to finance global health demands. So, dear friends, ladies and gentlemen, let me close. Financing health for all. In a time of scarcity, this is a global, regional, and also a national responsibility. It remains a huge challenge. There is no doubt about that. But it is a challenge that we need to address together with determination and endurance, and I believe that we learned a lot from each other also during the difficult times of the pandemic. So I hope that the next time when the WHO declares a global emergency, and we know that it's not only a theoretical option, we need to prepare for that, we will have made the necessary investments into strong and resilient health systems, and that we will truly have achieved a better health for all. Thank you very much.